I did my project on Arthrex, the key to Achilles repair. What is Arthrex? Arthrex is a percutaneous Achilles repair system. It is a minimally invasive surgery to fix a ruptured Achilles. It uses a small incision, that's what makes it minimally invasive, and it also uses a unique suture technique to reattach the ruptured Achilles, which is what really sets it apart from other Achilles repair techniques. So as you can see, this is pictures of the surgery being done. It'll make more sense when I talk about how it's done. It starts by using a 2 centimeter long longitudinal incision made slightly proximal to the rupture site. An Alice clamp is inserted or used to pull down a healthy portion of the proximal end of the tendon. Once you have the healthy portion, you can place the Achilles jig system inside the paratendon. This helps decrease the chance of nerve damage. Then the sutures are placed inside of the jig system. That's what's being done in these pictures right here. Here are the sutures, and here's the jig system holding the Achilles down. And then once the jig system is removed after the sutures are placed in them, the sutures are organized and stitched in a particular pattern that creates a really strong stitch at the top of the tendon, and this really helps with a faster repair. Then you do the same thing to the distal end. And once the jig system is removed from the distal end of the ruptured Achilles, then you organize the sutures from in the order that they were placed, and then you tie the sutures that are farthest away from each other together. You do this, and then you keep moving closer to where the rupture site is until you tie all the sutures together. After that, you just sew up the incision and the procedure is over. So commonly used repair techniques. The three most well-known repair procedures are the bundle, the Kessler, and the Krakow. These are all open repair techniques which require an incision of at least 6 centimeters long. But the difference between all these techniques is the way that the sutures are laced. And the first one is the bundle. Here's the Kessler and the Krakow. The bundle is the most commonly used open repair technique because it has a stronger hold when it repairs. It has a less chance of re-rupturing, and the Krakow has the most chances of re-rupturing, and that's why it's the least used. So what makes Arthrex better than these three? This procedure produces a lower chance of re-rupturing the tendon with the strong sutures. The Arthrex also reduces the potential risk caused by open surgery techniques like infections and wound healing issues and dysesthesia. Arthrex also leaves a smaller scar since it has a smaller incision, obviously, and the open repair techniques can cause damage to the paratendon and lead to impaired blood supply or nerve damage, which is reduced in Arthrex when you insert the jig system into the paratendon. So Crystal Clinic Orthopedic Center. This is where I did my 15 hours of job shadowing. I shadowed a nurse who worked in the surgical center. I watched her give post-operative care, pre-operative care to the patients, which was mainly her giving IVs, taking IVs out, checking their heart rate, their blood pressure. I was also able to sit on a couple surgeries. I watched a broken elbow get fixed with plates and pins. I watched a trigger finger release. I watched a hand with arthritis get a knuckle taken out. And I also watched a bunion get removed. So I'm really thankful that I got the opportunity to observe there and really understand and see what it was like to be a nurse, which is what I want to do when I'm older. So, thank you.